Things are heating up here on Wave 3 Listens. Thank you so much for joining us. Your phone calls are welcome. 571-5263. We're talking about interesting topics like losing a little weight. How about your libido? That seems to be a hot topic here lately. All of those things can be fixed. Give you renewed energy. You're going to get compliments from your friends. You're going to look great poolside. And Lisa Innenbach is here with us. Lisa, HCG. Now, you know, it's always good to have a testimonial. When you have someone who says, hey, this works, I'm a happy customer, a happy client, and you have a friend with you today.
I do. This is Laura, and Laura's done some of our procedures at Body Shapes Medical. So, you know, there's hormone therapy, there's HCG that gets the weight off. Laura's had great success. She came to us in January and started on her program. She's down 30 pounds, if I'm saying that correctly. Yes. Is that the total amount so far? 6.5 inches off of her waist, and she's decreased her body fat by 5%. So,
I mean, you know,
just in a couple of months here.
Well, you look fabulous.
Thank you.
If you would, tell us a little bit about, I guess, some of the ancillary benefits. Obviously, your physical appearance has changed, and you look great. With that being said, compliments from the husband. Let's talk about your confidence, and you tell me about your thoughts. I don't want to put thoughts in your head. You tell me.
Well, first of all, losing 30 pounds in 60 days was a lot of fun. It was the best diet I've ever been on as far as ease and excitement every week. When you weigh in, it's just, wow, I did it. And I had gotten to the point where I was so overwhelmed with all the weight I had gained since having kids and just putting myself last for 16 years that I got to a point where even when I would go to the gym, I would feel so overwhelmed because I was so out of breath, and I just thought, this is me for the rest of my life. And then I heard about Lisa's plan, and I went on it, and it's just so exciting. It has changed my life. Thank you so much.
You're welcome.
And I still have, you know, to get back to my pre-baby weight, I still have like 40 pounds to go, but this is the first time in my life that I've ever felt like I could get there. It's amazing.
I think it's pretty obvious your confidence level is up. I mean, just by you coming on this television show and talking to us about it. So congratulations to you. How about family members? Your husband, maybe some of your friends, are they also noticing as well?
Oh, yeah. People ask me all the time, oh my gosh, how much have you lost and how'd you do that? And I just can't shut up about it.
Well, that's a good thing.
Laura sent quite a few referrals to us, so thank you for that.
You're welcome. And everyone I've spoken to loves it. Anne-Marie, I saw her at the track last week, and she lost 11 pounds in her first week, and she's so excited.
Yeah, it is exciting. I mean, you know, I'd like to point out the staff, too, and I'm sure Laura can attest to this. When you come in, I mean, we make it fun, we make it exciting. Losing weight isn't always the most fun thing to do, but we try to make it as exciting as possible, keep you on track. Even if you've had a bad week, you know, we let you know, hey, don't let that get you down. You're going to do better next week, because, you know, sometimes people do fall off a little bit, but we do make it exciting, and the staff is absolutely amazing.
All right. Once again, Body Shapes Medical. Let's grab some phone calls. If you don't mind, Laura, some of these may pertain to you. They may be asking about your experience, so this may be perfectly appropriate to have you on set with us. Let's go to Nancy here in Louisville. Nancy, welcome to the show. How are you?
I'm fine. How are you?
Good. We're doing well. Thanks for watching. You have a question?
I do. I am a breast cancer survivor with estrogen-positive breast cancer. Can I take these hormone treatments to lose weight?
That's a great question, Nancy. My answer would be it kind of depends on how far out you are from your breast cancer, and we would have to speak with your oncologist about that and possibly get a note from him saying that it was okay. Studies have shown that the hormones replacement that we do absolutely does not increase your breast cancer risk. In fact, it actually decreases it. But we are the better safe than sorry kind of approach, so we would want to make sure to speak with your doctor, get with him, possibly get a note from him, speak with him on the phone. You know, we'll do it all, take care of it all for you. Come on in, let's see if you're a good candidate. If you're not, that doesn't mean there's not another program that you can do. We do nutritional counseling, regular weight loss. We have some prescription medications that we can use with you that are perfectly safe with breast cancer survivors. So again, the consultations are free. It's not going to hurt to come in and let's just talk and look over your history and see how it goes.
See, I like that approach because I know at Body Shapes Medical it's important to you, the medical side, the medical trained staff, that's important, and we want to make sure that you work with your doctor, et cetera, because you know, you can't have a coverall statement for everyone. Everyone's blood work, everyone's past medical history is different, so there we go. I like that. Okay, let's try to grab another one here. Let's talk to Linda, who is calling from Mount Washington. Linda, welcome to the show. How are you, Linda?
Fine. How are you all?
Thanks for watching.
Yes. I have a question for Lisa. I had a breast biopsy done back in 2004, and it came back precancerous, and I went to an oncologist, and he put me on tamoxifen for 5 years. I've been off of it now for about 3. So I was wondering, would this be contraindicated for this type of diet?
Linda, that's a very similar question to the last one that we have. Again, it is not a contraindication, but we would have to get with your medical doctor to get a note and just make sure. You know, when it's a hormone cancer, we have to be really, really careful. But you said back in 2004, it sounds like you've been plenty of years out. But again, better safe than sorry is our approach. We'd like for you to come in, get your, you know, your physical assessment. Let's talk to our team and make sure that everything's safe for you. So I'm not going to definitely say that you can't, but can't definitely say that you can until we come in and get the full history.
Yep, good answer. And I want to show you a quick chart here. Now this is, we're talking about hormonal imbalance and aging. Something we all would rather not talk about, but hey, why not do something about it? And tell us about your thought process here with Body Shapes Medical.
Well, with the hormone replacement, you know, once you reach about the age 40, you might notice, you know, you're gaining weight. You can't seem to take it off. Again, the HCG will help with that initially, but you can't be on that forever. We do nutritionally counsel you afterwards to make sure you are keeping the weight off. But there are other symptoms that you may be experiencing that aren't just weight related. If you've lost, you know, libido, if you're experiencing fatigue, if you're having trouble sleeping at night, anxiety or depression, a lot of doctors will just, you know, give you an antidepressant, and a lot of times it's really not depression. It's just your hormones are out of balance. Less energy, joint pain, if you're becoming more forgetful. All of these things are symptoms that we can treat no matter what your lab work says. If you have those symptoms, we can treat those symptoms. We do get labs, though, I do want to point out, just to make sure and see where you are baseline. But if you are symptomatic, your regular doctor might say, oh, but your labs say that you're okay. But I don't feel okay. So if you don't feel okay, let's start replacing you and see if you can feel okay and that you can feel better and like you did when you were a little bit younger.
All right. Interesting. Coming back, we're going to talk to Laura about some of those changes and how she feels. And I think that's fantastic. Look at her smile. Boy, that energy level is up. And we'll talk more to you and your calls to Lisa Innenbach with Body Shapes Medical. We'll be right back on Wave 3 Listens.